Provider Spotlight, where every week we are coming here to interview the most amazing private practices from all over the United States. It is such a treat. Every week we have someone brand new, new specialty, and most importantly, we're getting brand new perspectives, things that we haven't thought about before, new discussions. And so I am so excited to introduce our newest guest to you. Dr. Shaina Nolley. She is the owner of Caim Chiropractic in Austin, Texas. Welcome, Dr. Shaina.
Thank you so much. It's an honor to be here. I appreciate it.
We're so excited to have you. I know that we have a lot to dive into today, but want to start off with hearing a little bit more about you. I want to know a little bit, tell us a little bit about your story and what inspired you to open up your own practice and get into your specialty.
Yeah, so I actually did not start off in the health field at all. I started off doing music business, and I was living in Chicago for a while, and that was really fun. I was kind of climbing a corporate ladder, that kind of
Mhm.
stuff. And ultimately, it kind of just led to burnout and just not really feeling like I was fulfilled or kind of in the right place. And honestly, around the same time, I started having, some health challenges myself. So, to share a little bit about that, I actually started having something called non-epileptic seizures. And around the same time, I also hurt my back. So, I was being medicated for these like neurological things that were happening that we couldn't really figure out. Um, hurt my back and I went to the chiropractor as you do for, back pain. And I was really surprised when I started noticing that my seizure activity was actually like happening a lot less. And at that point, I mean, my back got better, which I anticipated, but I didn't realize, the nervous system impact that, chiropractic had or anything about the neurology behind it. So ultimately, I actually got off of all of my seizure medication, which was life-changing for me. And at that time, I was just kind of like, I had a great chiropractor and he, pushed me to kind of come and shadow him. And I just fell in love with it. I was like, this is so cool to like, piece together things in such a different way. So I ended up going to Life West out in California, which is my alma mater. And I went to visit and I just fell in love with the school. Everything, really resonated with me. And I just kind of dove in head first, which was crazy, but also super exciting. Um, and during school, I actually got my applied clinical nutritionist certification as well as I was studying to be a DC. And that was really cool because I started really diving into the functional medicine side of things. So I
Mhm.
was kind of getting all of this like neurology behind chiropractic. And, on the chiropractic side, that's why my history with the seizures is why I focus more on a neurological model as opposed to a pain-centered model with chiropractic, um, which was super cool to experience. But I started getting really into functional medicine too during that whole process. So I got that, nutritionist certification. And after I graduated, I went along to the Functional Medicine Academy, where I specialized in gut health and hormones, which was really cool because I got to really understand how to look at the body as a whole and create a more functional approach and analysis to healthcare. Um, and so, shortly after that, my partner, Dr. Syra, and I, we moved to Austin, Texas, and we opened up Caim Chiropractic plus Functional Medicine here. And it's been amazing ever since. Caim, just a little bit about Caim, because I know it's a funky word and people always ask like where it came from. But Caim actually means sanctuary. It's a Celtic word for sanctuary. So we ultimately wanted to provide, a safe space for people to feel, loved, and kind of receive the healthcare that we really envisioned. Um, and so shortly after we opened, I started seeing people for functional medicine, which is all virtual, which is really great because I can see anyone in the states of California and Texas, which is where I'm licensed. And, kind of naturally, I started having these women come in who were focusing a lot on preconception care. And they were really interested in kind of optimizing their body for pregnancy and kind of figuring out, they were like, I feel weird, like I don't feel right, but my labs are all normal. So, like, what's going on? And so I started really kind of diving into like the functional fertility side of things with my
Yeah.
patients. Um, and that's why I like recently, so what I've been creating now is a full preconception program. It's called the Baby Making Boot Camp, and it's basically a 6-month preconception fertility kind of guide that includes a bunch of labs and, coaching and that kind of stuff to help people throughout that process.
I love that. I love your whole journey from going from music business to you're like, oh no, I am experiencing my own medical difficulties, which I think, when providers go through that themselves, I think they have a lot more empathy for,
Totally.
what other people are going through, especially if it's a similar same thing, but also you knew the battle and you knew how much it took to get better, what it was like to be seen by someone that you knew, liked, and trusted, with your care.
Huge.
And I'm sure that's how you approach things every day, is that you want to treat people like how you were treated and how you want to be treated. And so I love that you are building that within your practice. And it seems like you've, aside from the chiropractic side of things, getting into functional med and then helping, folks that are trying to conceive, do so and prepare their bodies, before, during, afterwards. I'm sure you have it all. But to that aspect, I would love to hear about, all of your different service offerings. Maybe
Yeah.
sharing even with us, what are some of the most common things that you're treating or finding people struggling with? Or maybe there's even uncommon things. There's things that no
Mhm.
one really thinks about when they say, oh, I'm going to go to a chiropractor or I'm going to go see a functional medicine provider about this. And maybe it's something niche, that you do, or maybe it's just no one thinks about it. And you're like, yeah, I do this all the time. And no one
Yeah.
realizes. So I'd love to hear your perspective on those things.
Yeah, absolutely. So, I know there's kind of like two things we're talking about, so I will keep them as separate so that we can kind of like go on that same trajectory. But
Yeah.
for the chiropractic side of things, we have primarily a prenatal practice. So I would say
Mhm.
about 80% of our patients are pregnant, which is amazing. They're the most fun population to work with, in my opinion. But ultimately we do see, the whole family. We see the mamas, the dads, the kiddos. Dr. Syra actually has her pediatric experience certification, which is like a whole other kind of certification. So we really love seeing like, colicky babies and babies that are struggling with constipation, like these things that you don't really think about. With especially like babies or taking a baby to a chiropractor, that seems absolutely crazy. But really like looking at their little nervous system. So that's actually a good segue. We do something called insight scans for all of our new patients, which basically is looking and mapping out the patient's nervous system. So it's looking at stress patterns and ultimately giving us like objective data-driven information that we can use to, create, care plan recommendations or, we really find out where their body needs to be adjusted as opposed to, just a general, adjustment. Everything's super personalized, which is exciting. But ultimately, just trying to not just chase symptoms and really look at that neurology because of my own background and that kind of stuff. So that's kind of the gist of like the chiropractic side of things.
Yep.
So, regular adjustments. We focus on prenatal, family care, pediatrics, that good, all that good stuff. And then as far as like functional medicine, I specialized in gut health and hormones, which so a lot of people are coming to me with digestive concerns where all, colonoscopy is normal, blood labs look normal, they're really not understanding, why they're still having these symptoms. So really looking into functional testing. So I specialize in things like the GI map test, the Dutch test. functional blood panels or reading blood panels in a more optimal lens. Um, that's kind of like where we're really investigating or digging for like root cause symptoms.
Sure.
Um, and ultimately, for the functional fertility side of things, the labs that I run for that are looking at hormones, they're looking at gut health as well, looking at toxin burden. So, looking at things like what kind of toxins there might be in their environment, because that can significantly impact hormone function as well, which impacts fertility. And really diving deep into things like blood chemistry to see if there's any nutrient deficiencies and that kind of thing. Um, yeah, so I think I covered
That's
most of
the
the
gamut.
services. Yeah.
That's a ton. It's amazing, just things that you mentioned, especially on the functional medicine side. It's so crazy, all of the things that are running rampant in our environment and toxins that we wouldn't even know about it. I was talking with another physician, and he was telling me that a lot of mold resides, like ironically and weirdly enough, like you wouldn't think about it, but schools
Oh
are like a
yeah.
big one. And it's just like, oh my gosh, it's where our children grow, and you would think that'd be better, but I get it. Like some of them are really old schools and they might have water damage and all these other things. And so it's just so interesting to learn how these things can affect our hormones, affect our way of being, and not functioning optimally. So I love the fact that you have brought that up and also how it coincides with conception as well. And yeah, huge.
That's actually, I have an entire model in the baby making boot camp pro or module in the baby making boot camp program because it's that important. Just like how big of how much our environment impacts hormones, which impacts fertility and conception. Totally.
It's so important to talk about, and I think these are some of the things that, we don't have access to or we're not understanding or learning. And so I'm so grateful that you're sharing all of these nuggets of knowledge with us, because they're so important. And to that aspect, I mean, you guys seem amazing, and all the
Oh,
things
thank
that you're
you.
providing, and the baby making boot camp sounds fabulous. But I would love to hear, also about, your approach and, how it's a little bit, unique. And, I think you are, by doing functional medicine, by doing chiropractic, you're already offering things that many people, maybe they just see one or the other, but it's great that you kind of in combo can
Yeah.
do it all. But would love to hear a little bit about your unique approach and how you would, really work with somebody.
Yeah, I would say like the main thing that really I think keeps us unique is that we really strive to connect the dots. And
Mhm.
whether that's looking at, it's not just listening to symptoms, but it's asking the question of like, where is this dysregulation coming from? And, finding the data needed to really dive deep and see what's causing that dysregulation, whether we're investigating that through insight scans, looking at the nervous system in and of itself, or if we're looking at, specific labs like blood chemistry or um, that kind of thing, looking at the GI map test or something to really dive deeper into that comprehensive lab work to figure out what's going on. And I would say like our ultimately too like our nervous system approach because I think having that be the basis of like all of the work we do I don't know I think that that's often like underappreciated in a way
Yeah.
of like not realizing how much the nervous system impacts every single thing in our entire body. And it's kind of like the motherboard of the body. So it's controlling everything. So whether it's looking at fertility or looking at chiropractic or pain or, anything, having that kind of nervous system approach, I think kind of sets us apart. Um, and ultimately, it's everything. And I think it's a huge reason why we have, why we get such great results with our patients too, and help them get to their goals. Um, yeah, I think that's kind of the main reasons that, that might set us apart a little bit. So really kind of diving deep, really looking at that dysregulation and really having like a nervous system approach, which is like the basis of our whole practice.
I love the the root cause approach, and diving in deep. I think, it's really nice to find a provider that's willing to go in there with you, go to the uncharted territories of like, we're going to figure this out together. And so,
Yeah.
I love that it's like, we're going to pull up our bootstraps and we're do a little testing and we're going to figure this out. But in
Mhm.
the nature of what you do, both either on the chiropractic side, functional med side, or even just from the nature of working with people that are looking to start and have families or they're having families, there is a lot of, and I kind of alluded to this earlier, a lot of like misinformation, a lot of things that are going
Yeah.
around. And, it's great in a sense where we have Google, we do have ChatGPT to investigate, but it's not always true, right? Like how many times does,
Yeah.
that gaslight me every day? And I'm like, I know that answer and that's not right. But I'm sure there's also like old wives' tales and things that you're like, oh, like my mother told me this, and I'm sure you're hearing that. Or my
Hmm.
aunt told me this, and this is what you should do, and da 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 da. So that all being said, there's a lot of misconceptions. And is there anything that sticks out to you of like, I hear this all the time, or Dr. Syra hears it all the time, and I would just love like a PSA for whatever this is that do not do this, or this is definitely not true. What would you
Yeah.
just love to debunk like once and for all?
Yeah, I love this question so much because I love getting information out to people.
Yeah.
And honestly, I can't just choose like one thing. So I'm gonna give you
Yeah,
four tips.
I love it. Let's do
So
it.
yes. So the first one that I see all the time that drives me up the wall a little bit is my labs came back normal. So
Uh,
I'm fine. So for me, really looking at what is normal, right? Like that's the question of like, okay, well, what's normal? And in America here, like normal just means that you're not in a diseased state.
yeah,
Um, that doesn't mean that you're optimal. And so there's a huge difference, when really like not knowing, why do people, sometimes people are like, I've been trying to get pregnant for a while and I'm not understanding what's going on. And I look at, their thyroid, for instance, and no one's run anything other than just a TSH marker. And so they're not looking at antibodies or if there's an autoimmune component to the thyroid and, all these different things that we can investigate that contribute directly to fertility and being able to conceive. So I would say number one, getting a functional approach to your blood labs in general, I think is so underrated. I think that really filling in any gaps nutritionally that we're seeing, even if it's showing normal, again, that just means you're not in a disease state. So really looking at optimal markers to kind of make the like that's where supplements can work best before the need for, before you're in a disease state and need medication, that's where supplements really shine and we can kind of get those results for people. Number two, I would say is when people are saying like, "Oh, I'll just kind of worry about this whenever I'm ready to try," or with conception and that kind of thing. So we know that egg follicle maturation can take up to 90 days. So honestly, what you're doing today, whether it's how you're, the kind of sleep you're getting or what you're eating, the exercise that you're getting, the movement of your body, how your nervous system is functioning today is basically affecting the egg that's going to mature 3 months from now. So I would say really starting sooner than you think can kind of help prepare your body a little bit more efficiently. Um, Number three, I would say a common misconception people that I hear a lot is that fertility is a woman's issue. I think we're kind of getting out of that a little bit in today's society, but
yeah,
we do know that, male fertility, affects about
yeah,
50% of fertility challenges today. So if I'm working with a couple, I prefer to work with both partners so that we're really tackling, both sides of this. I want both of them at the table. And also that helps with helping them to support each other through the program itself. So I find that there's more success when they do it together, and so that's my preference. But for the program, I do have single options and couple options because everybody, different situations.
yeah.
Um, And the last one, I think you kind of touched on this with like looking at ChatGPT and like that kind of stuff, which,
Yeah.
it's amazing. But hearing people say, like, oh, I can piece together my own protocols or I can come up with my own supplement programs or, from Instagram or whatever. So a lot of times I have patients who come to me with like a bag of supplements and when I'm looking through it all, I'll find things like, oh, these aren't therapeutic dosages. So there's not even like a dosage strong enough to have a physiological effect in the body, or maybe some things are working against each other that they're taking, or maybe they're missing a key nutrient, or it might be a quality issue with the supplement. They might be getting a different form of the herb or whatever, than is going to be best absorbed in the body. So I think I think it's easy to go down that route, but I also
Yeah.
think that that's where, a lot of misconceptions happen and people think functional medicine doesn't work. And then, you really investigate and you're like, oh, you're not even getting a therapeutic dosage of this herb or something like that. So I think I hope that's helpful, but those are, the top four that I have, in terms of kind of common misconceptions that I see pretty frequently.
Yeah, those are huge. And I mean, I really also like the last one because I think, we all, whether you go into your local grocery store or Amazon or what have you, and you think because it has all these ratings that it's going to be the best, supplement for you. Um,
Yeah.
and that doesn't, it's not necessarily true. And so
Mhm.
that is also really important. And to just be skeptical a little bit about what you see online and make sure that you talk about it with your provider.
Yeah,
Someone like
100%.
you. No, I mean,
We've
it's
done the research.
amazing. Yeah, do the research. And
Mhm.
so, yeah, those, I mean, in terms of, conception and how our bodies are working, I think again, a lot of families or to be families may not have thought about these things or have heard of these things before. And so I love your misconceptions and even I think you have more. I think you have more in your future,
There's
but
more.
something that I also like to think about as well is that we kind of round out today is you've already given us so much to think about, but I think some great pro tips as you debunk some things for us, but are there things that we can do today, not only from the patient side, I'd love to hear like what can move our health in a better trajectory, but also for other practices. Like, are there things that you are doing today that you're like, oh man, like this is, I wouldn't be able to live without this? Or is there something that we can learn as providers as a group. So I anything that you're willing to teach us today would be awesome. And then anything that you'd love to share about baby making boot camp. I'd love to hear, even if it's a pro tip or something that you want to include, or a
Yeah.
little teaser to baby making boot camp, if you will. I'd love to hear it because all the things that you've given us from the fertility aspect has been really interesting.
Yeah, absolutely. I would say I'll focus a little more on like the patient side of things because I
Hmm.
really want people to, I mean,
Yep.
practitioners too. A lot of
Hmm.
practitioners don't even know some of these things, which is
Yep.
no fault. It's just
Hmm.
that I've, d dove into this kind of from a
Yep.
research standpoint too. But
Yep.
I would say for practitioners, I think where a lot of times like I see us get into trouble is when we create standardized protocols for every person.
Yeah. Hmm.
And I think that sometimes that can be dangerous for people, or that can, it can hold us back from the results that we're trying to achieve.
Hmm.
So I think really taking like we have never, copy and pasted a protocol from one
Hmm.
patient to another, and that's very intentional because we're
Hmm.
such individualistic beings, and have, taking that kind of approach is not just going to help your patient retention because they're going to feel how much intention is behind that, but also you're going to see more positive results because you're really focused on what that person in front of you needs and not, what someone else might, oh, this worked for this person.
Yeah.
So, that kind of thing. Um, From the patient side of things, I've got some great fertility tips and that kind of stuff I want to throw in. So, I mentioned how like there's an entire module on just like endocrine
Yeah.
disruptors and how to start, clean living. So, I would say number one is going to be to audit your products. For endocrine disruptors. So, looking at things like skincare, looking at your cleaning supplies, looking at your cookware, look for things that say things like phthalates, parabens, synthetic fragrance, all of these kinds of things are going to disrupt the hormonal system. They're going to be endocrine disruptors. And that can definitely have a big impact on fertility. I would say like a lot of times people feel very overwhelmed with this piece of advice because most people have heard it before, but I would say like the best thing to do is just start small, and
Yeah.
as you run out of something, just look for one healthier alternative, and over time you're gonna, be able to build up that standard of toxin-free kind of living, but definitely putting like leftover food in glass instead of plastic, like that's huge. Don't microwave your food in plastic because that can leach into the food, that kind of stuff. So really mainly about kind of slowly switching out those products is my number one tip because of the big impact it has on hormones and fertility. Number two, I would say really focusing on sleep as a fertility intervention, because honestly it is. So we have, melatonin is only produced, it's a super powerful antioxidant, but it's produced during deep sleep. And melatonin has a huge impact on protecting egg quality. So I would say like really starting off making sure you're getting like 7 to 9 hours is pretty much a non-negotiable for my patients who are in that prep phase, to kind of help with that egg quality protection. And then the third tip I have, like fertility wise, is going to be to start on prenatals before you think you need to.
Mhm.
Not just like once you get a positive test. So if you're prepping, I usually have my patients on prenatals because things like folate, B vitamins, CoQ10, these things a lot of time they need time to build up in our system. And so I always recommend people starting early on those things. And then ultimately just making sure that you're working with a practitioner who's really looking at your specific labs and building protocols off of your labs and not just, oh, I saw this and bought this, this recommendation that someone built that's like evergreen kind of content. I think it's a great jumping off point, but really focusing on like what your labs are saying is going to be where you're going to get the most benefit. Um, and if any of this like resonates with people, I do offer for both the functional medicine side, if you're not even wanting to get pregnant and that's not even, in your future and you just want to work on gut health or hormones,
Yeah.
or functional blood chemistry, for my regular functional medicine patients and for the baby making boot camp, I do offer free 15-minute consultations. So those can easily be scheduled on our website, and that's where you can get all your questions answered. We can talk about your goals or your symptoms, and I can kind of describe how I might approach your specific case. And there's no harm, no foul. It's completely free just to kind of pick my brain, and I love opening up the door to those conversations because it always is great to be able to connect with people in that way.
I agree. And I thank you, Dr. Shane. I love all of your pro tips. There are, I think, things that we can really all keep in mind from both provider, patient side of things and just regular people. Just, there's things that we gotta do. We got one body,
Yeah.
one life, serve it well because it's got to carry us through um, for a long time. So that being said, we really appreciate your time. And before we leave off, I know that you had shared where folks can reach out, website, but I know that you do some pretty neat videos on your social media as well. So I want to give you a
Yeah.
chance to share some other resources or any other places that folks can check out where they can get some really awesome information from you all or just to have a conversation. So I'll let you feel free to give any of the shout outs or anything up and coming like the baby making boot camp.
Yeah, absolutely. So, I mean, join our crowd. You can follow us on our chiropractic page. That's where you're going to see more of the chiropractic side of things. Also, a lot of like general functional medicine kind of tips and stuff like that. We do a lot of educational content. So that is for the community. That is just purely to support, people who are looking for information.
Mhm.
But our practice Instagram is Caim, Caim _ chiropractic. Um, and if you're local to Austin, Texas, we're on North Mopac. So if you want to come by the clinic or schedule an appointment, I'm happy to help with that as well. We also have our caimchiropractic.com website. So they can, that's where you can find out more information about us. You can schedule appointments. We have educational blogs, all kinds of goodies and information on that website. And then specifically for the baby making boot camp, which is coming up soon, I do have an Instagram account that has been created, but I will slowly be starting to post on that. But that's going to have a ton of fertility information, educational content, all of that good stuff. And that Instagram handle is the baby making boot camp, so all one word. Um, and I also have a separate website, which is caimfunctionalmedicine.com. And that's where you'll find all of the fertility stuff around the baby making boot camp, with that free 15-minute consultation. There's a calendar there. There's going to be educational content there as well, too. So we have caimchiropractic.com and caimfunctionalmedicine.com for all of our information. And then you can always just DM us on Instagram or, Facebook as well, where we try and respond as quickly as possible. But we're pretty easy to get a hold of if anybody does have any questions or wants to schedule any appointments with us.
Awesome. Well, thank you so much, Dr. Shayna, for sharing with us today, sharing your story, but most importantly, all the nuggets of knowledge. We very much appreciate it, and we hope to have you on again soon.
Yeah, thank you so much for having me. This was great.
Yeah.